Hello and welcome. It's 11 a.m. in Seoul. I'm Kim Mo-gyeon at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Gov'T, the overall coordinator first of the Central Disaster and Safety Countermeasure Headquarters, will be briefing us on the coronavirus situation here in South Korea and fill us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially ahead of the National College Entrance Exam, also known as Suneung, set for tomorrow. Now, to give you a brief idea, as we wait, South Korea reported 511 new cases of COVID-19 Wednesday, returning to the 500s after falling slightly over the past 3 days. Now, let's get over to Sejong Government Complex.
Let us now begin our regular briefing for December 2nd, Wednesday. As of today midnight, we have a total of 493 new local infections. And among them, in the metropolitan area, we have 356 cases. And in other regions, we have 137. And we did not have additional fatality. And starting from the 26th of November and until the 1st of December on a daily basis for the past week, we have 472 cases on a daily basis, and about 66% of them were clustered in the metropolitan area. And in the metropolitan area, the trend is very similar to that of last week, and we are seeing the daily cases hovering around 300. And we are not yet seeing a rapid surge in the number of cases. This is a positive factor. However, we do not see a plummeting of the cases as well, and so forth. We see continued risk factors that exist in these areas. And in the non-metropolitan area, we are seeing the trend of expansion of the virus. And in Gyeongnam, we have 54 cases. In Honam, we have 37 cases. In Gangwon, we have 14 cases. And aside from Jeju and Gyeongbuk area, we are seeing a rapid increase in the daily cases in all regions. And today, we would like to note that it's the 14th day since we have elevated the social distancing level to level 1.5 in the metropolitan area. And we believe that if we have abided by the quarantine measures, we will be revealing some of the results very soon. And thanks for the public participation, we are seeing a rapid drop in the amount of foot traffic. And from the 28th and 29th of November, we have seen the mobile usage also drop. And compared to the past 2 weeks, we have seen that this has dropped by about 23%. And after this implementation of the intensified quarantine measures, we also have seen an 11% drop in foot traffic. And during the next week, we also saw a drop. And compared to the previous 2 weeks, we have seen 23% drop. And despite the many difficulties, we also would like to extend our deepest gratitude to all of the individuals of the public for your continued participation. Until we have the effects of the social distancing measures, we believe that very soon we will be seeing unfolding of some results and some achievements very soon. And in order to also overturn the current outbreak trend, it is very important for us to continue our quarantine efforts. Please abide by these quarantine efforts going forward. And with the increase of the daily cases, we also have many cases of critically ill patients, and they now stand at 101 as of today. And to this end, the government is preparing for an increase of the patients, and we are also exerting our full efforts to secure enough hospital beds for the critically ill patients. And as for the critically ill patients, we have, during the past 2 weeks, weeks, we have seen that 24 hospital beds that can treat critically ill patients have been added, and we also added 11 more hospital beds, and we are also making this operation going forward. And among them, we also have the utilization rate of these hospitals, and we have about 44 hospital beds that are available for use immediately, and we have a total of 59 hospital beds for the critically ill patients that can be utilized very soon. And to this end, we also have 30 additional emergency use hospital beds at the National Central Public Health Institute, and we also will have a mobilization of more hospital and medical staff members as well. And to this end, we will also make sure that people are also transmitted to these hospitals if they have critical symptoms, and we will also utilize our medical capacity to the fullest. And we are also designating special hospitals for the light symptom patients as well. And we also have seen that the utilization rate of these hospitals stand at 65.2% and 67% as for the life treatment centers. And as of the 11th November, we also have seen that we have about 4,000 hospital beds available, and we have added additional of 500 beds for the designated hospitals as well. And going forward, we will increase these capacities. And we have 4 life treatment centers that are designated by the central government, and 12 also run by the local authorities, and we will have 1 additional which will open its doors, and we have room for about 3,500 patients. And starting from next week, we also have 1 additional life treatment center in Gyeongbuk area, and also 5 additional across the country, so that we can account for more than 1,500 additional patients. And as for the life treatment centers, there are many local governments who are exerting their full efforts, as well as many governments and as well as medical facilities for mobilizing and dispatching their doctors. So we would like to extend our deepest gratitude to once again. Here are some details for the life treatment centers. And the life treatment centers also house the patients who stay about an average 10 days until they show no symptoms. And we have had about 830 cases who have been admitted, and about 260 have been also discharged. And more people are being discharged right now. And we believe that this week we will have about 1,200 people who will be newly discharged. And we are also continuously treating the light symptom patients, and we do not have a significant burden as of yet. Going forward, we will monitor the outbreak trend and also monitor the operation status of these hospitals and life treatment centers as well. And the Life Treatment Center is also carrying out a remote treatment and diagnosis services. So here are some details. In order to minimize physical contact between the patients and the doctors, we are ensuring this remote service to also utilize our medical capacity to the fullest. So the patient checks his or her temperature on his or her own and puts in this information on the application, which is also transmitted real-time to the database that is run by the medical staff members, who can also look at the symptoms and conditions. And if also there are abnormal symptoms that are presented, the patient can also press an alarm, which is also connected to the database that is operated by the medical staff. And through this system, we have seen that this has contributed to reducing the risk of infection, and we also seen a decrease of the burdens on the medical staff as well. And such remote services starting from yesterday has also been utilized at the Gyeonggi-do province Yongin City. And starting from this month, we will also expand such services to other life treatment centers across the country. And until February next year, we will also sync this application and service to special applications and Bluetooth as well, so that we can intensify and ensure more usability for the patients. And currently, we have seen diverse cluster infections which are stemming from not only the family and social gatherings as well as office spaces, but also involving many multi-use facilities, including PC rooms, eateries, cafes, as well as public baths. And as for the meetings or gatherings that accompany group meals, we ask you to refrain from going to these places. And if you are going to crowded or confined places, please refrain from visiting them at all. And this outbreak, compared to those of the past, we are seeing an increased proportion of the patients under the age of 50. These, however, group of people are who have active social participation. So we ask you to get tested as soon as possible if you have symptoms. Tomorrow we have the National College Entrance Exam, which will take place. And until 10 p.m. today, we also have in plan the running of our screening clinic so that we can accommodate more people. And also we will have an emergency scheme until the end of Sunung. And this is a very important time for the test takers. So we ask all of you to get tested if you have any critical symptoms. And also before the testing day, we ask you to refrain from going to multi-use facilities and abide by the quarantine measures put in place at the test sites. Please ensure that we can grant a safe environment for our test takers nationwide. And the government will make sure that not only the Sunung, but also other college admissions procedures to follow will also be monitored closely by the government. And we will also like to make sure that we will have the safe environment for our test takers. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다.
That was a government briefing. You just heard updating us on the latest COVID-19 situation in South Korea, which confirmed 511 new cases on Wednesday, bringing the accumulated total to over 35,000. There was no additional death, with a toll at 526. Now that does it for our coverage of this morning's briefing. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.